প্রিয় দর্শক, শুরু করছি আপনাদের পছন্দের অনুষ্ঠান আপনার সুস্বাস্থ্য। দর্শক, এই অনুষ্ঠানের মাধ্যমে আমরা বিভিন্ন রোগ নিয়ে কথা বলে থাকি এবং এর চিকিৎসা পদ্ধতি নিয়ে আমরা জানতে চাই আমাদের অতিথির কাছে। আজকেও এর ব্যতিক্রম নয়। আমরা আজকে কথা বলবো একজন বিদেশি অতিথির সাথে, যিনি অস্ট্রেলিয়ান রিজেনারেটিভ মেডিসিন এক্সপার্ট ডক্টর পিটার লুইস। আমরা তার কাছ থেকে জানতে চাইব স্টেম সেল থেরাপি এবং পিআরপি থেরাপি, যেটা আমাদের ওয়ার্ল্ডে নতুন কনসেপ্ট, চিকিৎসার নতুন মাত্রা যোগ করেছে। ডক্টর পিটার লুইস, I am honored to welcome you in our Apna Sushastha program.
Thank you very much, Dr. Zia.
You are doing very well in the regenerative medicine expert worldwide.
Yes.
So first I want to know about PRP.
PRP is a treatment where we use the body's own healing properties from your blood to heal injuries such as arthritis of the knee or the hip or rotator cuff shoulder or frozen shoulder problems. So it's a natural form of healing, it's safe and it's cost effective.
What is the indication for the PRP or your criteria of the patient selection?
We like patients who have degenerative conditions of the joints, muscles or tendons. So osteoarthritis of the knee is our commonest treatment, but we also treat other joints such as the hip or the ankle or the shoulder. We also treat younger people with sporting injuries, so hamstring tears, knee injuries such as an ACL injury, medial ligament injuries. All these can be treated. And tennis elbow and golfer's elbow also have very good results.
We are very much prone to surgery.
Yes.
And surgery, you know, very costly to do surgery, and there is many complication after surgery.
Yes.
So this PRP is replace surgery?
You have common sense things like losing weight and good exercise. Then we have PRP. And with PRP, we try to prevent or delay surgery, which of course is surgery is much more expensive and more dangerous than PRP. We don't fix everyone with PRP. Our studies show about 80% of patients who have PRP therapy will have a very good result. We also know that even patients who have been told that they need surgery have at least a 70% chance that PRP will help them.
What is the procedure to do PRP?
Okay.
How you
Yes,
PRP you put on the patient?
Yes, we use the patient's own blood, that's why it's called autologous, and so it's safe because it's your own blood, and we take the blood just like when you go to the doctor to have a health check, like a cholesterol test. We take a little bit more blood than you would for a cholesterol test, and the key is we spin it in a centrifuge, and then that drops the blood that we don't want, the red blood cells, out, and we get the growth factors and the anti-inflammatory factors that are on the top of the blood. We then process them and activate them, and we inject them back into the patient. The process takes about 45 minutes.
You also mentioned the stem cell therapy.
Yes.
What is the difference between PRP and stem cell therapy?
Okay. PRP is easier, it's cheaper, and it's simpler. For patients who don't get a good result or have very severe arthritis, then stem cell therapy is an option. Stem cell therapy, we use the body's own cells from the fat that is in the tummy, and we do a mini liposuction biopsy. We take a small amount of that fat and we add that to the PRP. So you get the best of PRP and the best of the stem cells from your fat to make a mixture that has more power than PRP alone.
Which patient need stem cell therapy?
Yeah.
What is the indication of stem cell therapy?
Or patients who've maybe travelled a long way to come and see us and don't want to keep coming back. They want the most expensive but the best treatment first time, and then we may go straight to stems.
You have lots of experience
Yes.
In this side.
Yes.
So what is the very interesting experience you share with us?
I think one experience that I'm very happy about is that I actually tore my own hamstring 8 days ago. I could not walk.
Okay.
And I was very worried knowing that I was coming here to Bangladesh. I have very good doctors who work with me in Australia. One of them was able to inject me straight after my injury, and here I am walking comfortably. I've also treated a lot of well-known athletes, and we've been able to get some of the athletes back to competition very fast. Like we had a powerlifter who tore his chest muscle just before competition, and he was still able to compete 2 weeks later.
What is overlap between the ringside and regenerative medicine? What is the overlap?
Okay, as a ringside doctor, I always have had to be good with my hands. When you're a ringside doctor, it's exciting. You have to often get in the ring and treat people very quickly so that they can compete again. So I've developed a lot of skills of giving injections. And PRP is very much giving injections. So I know how to inject and how to use local anesthetic to make the injection not too painful.
How can PRP work in Bangladesh, and what is the aim for Bangladesh?
Look, I think it's very exciting what we can do here, because in Bangladesh there's an epidemic of obesity, diabetes and osteoarthritis. PRP and regenerative medicine really can help obese patients who have diabetes and osteoarthritis. And we can help them in Bangladesh without them having to go to Thailand or India for top quality medical care. So now at an affordable price they can get international standard care here in Bangladesh, and that's good for the Bangladesh economy, and I think we have the ability to really help people who need it to live longer and better.
আপা 4 দিনের ছুটি পেলাম তাই ফ্যামিলি নিয়ে
Welcome to Surecell Medical Centers, your total rejuvenation. Are you in pain, facing surgery, you feel weak or sick, or do you want to become the most beautiful you can be? At Surecell Medical Centers, we focus on the healing powers provided by stem cells and platelets that exist in our own body to treat a variety of medical and cosmetic conditions. After a thorough examination, you and your Surecell doctor will discuss your health situation in detail and explore how our signature PRP and stem cell procedures can boost your health, your strength, or your appearance. And even if you need a specialist that's not available with us, your Surecell doctor will put you in contact with the best in the fields that's right for you. Surecell PRP and stem cell therapies use platelets from your blood and mesenchyme stem cells from your tummy fat tissues that are perfect for safe regenerative medical applications and highly effective in boosting your body's own healing powers. At Surecell, we have 2 main groups of therapies. One for treatments where your PRP or stem cells are injected directly into the part of your body that needs to be healed, and the other where they are released into your bloodstream through an intravenous drip. Direct injections are perfect for more acute problems like pain in your joints, bones, or muscle tissue, arthritis, bursitis, tendons, and ligaments, and also for cosmetic treatments like breast enhancement and skin rejuvenation procedures. The intravenous treatments are very strong therapies for long-term rejuvenation and assisting in the treatment of illnesses like diabetes, stroke, kidney failure, allergies and asthma, potency, and Alzheimer's disease.
You went the international standard treatment in Australia and other worldwide, and you introduced this treatment in Bangladesh in poor cost. What is the goal of this treatment?
The goal of the treatment is to delay or avoid the need for surgery and to make people not just more comfortable, but I think one of my patients summed it up better. The wife said, my husband now, he's much happier. And we see people come in, they're in chronic pain. When they first arrive, they're miserable. You can see in their face, they haven't smiled for a long time. And when they come in for their final treatment, they're smiling again. And you know, in life, if you help people to smile, that makes your life worthwhile. Yes.
And is there any complication of PRP and stem cell therapy?
PRP is as safe as giving an injection of water. The complication rate is very low. It's very safe. It's probably the safest treatment that you can have. Stem cells, because it's more complicated, is painful when we give the injection. But we give the patient a painkiller when we do that. But it's worthwhile because the pain of the injection is much less than the pain of living with arthritis.
And I think this is the first time visit in Bangladesh, Dr. Peter. So, in the traveling, what is your experience in Bangladesh?
Know why you have diabetes. Hospitality and the food is overwhelming. And I've been really surprised. Because the doctors here have lived with me in my home in Australia, we're like a family now. And when I come here, it's like coming home, even though it's my first time here. And that made me feel so welcome. It's extraordinary.
Dr. Peter, in Bangladesh, there's lots of patients suffering from diabetes.
Yes.
They need diabetic treatment like insulin or any other anti-diabetic drug. Do you have any treatment therapy for them to reduce insulin or medical treatment for the lifelong? Do you have any treatment?
Yes. Look, regenerative medicine is a whole plan. It's not just injections. So we like to look after every aspect. So here at the clinic, we have a dietitian and a physiotherapist, and we really try to educate the patients to live better with better diets, using the low sugar diets to help them to lose weight, and a new type of exercise programs where they do small, frequent amounts of exercise so they can build up their muscle and reduce their need for the insulin-lowering medicines. Because a lot of the insulin-lowering medicines can have side effects in the long run. So the more we can control it with lifestyle change, the better.
The stem cell therapy and PRP therapy, there is a success rate in the worldwide
Yes.
in the patient, among the patients?
Yes. There was recently a study of PRP for knees that was a study of all the other studies. It looked at 551 studies that have now been done on PRP for knees. And it concluded that PRP should now be considered as a treatment of choice for moderate osteoarthritis, and it is very safe.
What is Surecell? You working in the Surecell as a medical director and regenerative medicine expert. What is Surecell?
Surecell is a group of doctors who are interested in regenerative medicine. We have training programs, we have data collection so we can improve the education, and we have patient education where we have websites and videos. So a major part of what we do is short educational videos that explain things to patients so the patients can understand, they don't have to ask a lot of questions for the doctor. It saves the doctor time, but also helps the patients to tell their friends about the treatment because they get these video links.
How do patients find out more about your treatment?
They go to the website surecellbd.com or surecell.com. We'll also get them there.
Dr. Peter Lewis, what is the most challenging work you have ever done?
The most challenging work was after the tsunami 10 years ago. I worked in the casualty department in Banda Aceh. Working there, it was like a war zone. I think people don't realise how badly Banda Aceh was hit. And that was extremely challenging, and we were working 21 hours a day, and you can imagine what the work was like.
Dr. Peter Lewis, you this time, first time in Bangladesh, you come to open Surecell, the stem cell therapy and PRP. For our people, in which area you open the office for the contact for PRP or stem cell therapy?
In Dhaka, in Gulshan, the suburb of Gulshan.
In Dhaka, Gulshan, your office Surecell for treatment.
Yes.
And you told about the poor patient, there is a subsidized, some sorts of subsidization is there, okay?
Yes.
Dr. Peter Lewis, thank you very much to join with us in Apnar Sushastha program and give us valuable information about stem cell therapy and PRP. Thank you all.
Thank you.
প্রিয় দর্শক, আজকে আমরা স্টেম সেল থেরাপি এবং পিআরপি থেরাপি নিয়ে যে আলোচনা করলাম, ডক্টর পিটার লুইস যিনি অস্ট্রেলিয়ার রিজেনারেটিভ মেডিসিন এক্সপার্ট যে কথাগুলো জানালেন সেটা হলো যে অনেকেই অস্টিওআর্থ্রাইটিসে ভুগছেন, ডায়াবেটিসে ভুগছেন, টেন্ডন ইনজুরিতে ভুগছেন, বা যারা প্লেয়ার তারা লিগামেন্ট, ফ্রোজেন শোল্ডার ইনজুরিতে ভুগছেন, তাদের জন্য স্টেম সেল থেরাপি এবং পিআরপির মাধ্যমে অপারেশনবিহীন চিকিৎসা সম্ভব। দর্শক, এই চিকিৎসা করতে কোনো অ্যানেস্থেসিয়া বা কোনো ধরনের সার্জারির কোনো প্রয়োজন নেই, শুধুমাত্র পিআরপি এবং স্টেম সেল, এটা রোগীর রক্ত থেকে, এবং উনি বলেছেন যে রোগীর ফ্যাট থেকেও কালেকশন করা যায় স্টেম সেল, সেই সেল দিয়েই ইনজেকশনের মাধ্যমে নিজের বডিতে পুশ করে এই রোগগুলো সারানো সম্ভব। প্রিয় দর্শক, এই যে নতুন যে চ্যালেঞ্জ, মডার্ন কনসেপ্ট আপনার পিআরপি এবং স্টেম সেল থেরাপির উপর, সেই নতুন কনসেপ্ট ডক্টর পিটার লুইস আজ চালু করেছেন বাংলাদেশে, এবং বাংলাদেশের জনগণের জন্য উনি যে কথাটি বলতে চেয়েছেন যে বাংলাদেশকে ইকোনমিক কন্ডিশন বিবেচনা রেখে যারা অনেকে বাইরে গিয়ে চিকিৎসা করছেন তাদের আর যাওয়ার প্রয়োজন নেই, কারণ সুরেসেলের মাধ্যমে বাংলাদেশে চিকিৎসা সম্ভব। প্রিয় দর্শক, ভালো থাকবেন, সুস্থ থাকবেন, এই প্রত্যাশা রেখে আজ এখানে শেষ করছি। খোদা হাফেজ।
আপা 4 দিনে